Extra. I'm Kate Czaplinski, and we're here with some folks from Griffin Hospital who are part of the VITAHLS program there. Gina Smith, who is a VITAHLS coordinator, and Ruth Lazenby, who is a working member from the Massaro Community Farm. Ladies, welcome.
Thanks for having us.
Just talking to the mics
Sure.
there, sorry. And Gina, first, just tell me a little bit about what VITAHLS is.
VITAHLS is a partnership between Griffin Hospital, the Yale Griffin Prevention Research Center, and 4 local school districts, Ansonia, Derby, Shelton, and Seymour. And we were founded around 2010, where Griffin Hospital and the Yale Griffin Prevention Research Center reached out to the community and different school districts just to see, who was interested in partnering to fight childhood obesity. And these 4 school districts have been with us since the beginning, and we started programming in 2011. And what we work to do is to work with the schools to integrate programs into their existing school structure, so it's not anything in addition to what they're already doing. We don't want to burden the teachers, they're already overburdened. So what programs could be brought into the schools that can work along with what they're already doing in the classrooms, and in the form of nutrition and physical activity. So we're trying to just provide more opportunities for children to get up and moving and learn more about healthy eating.
Right. Now, I know I used to be Shelton Herald editor, and I remember kind of when VITAHLS got underway, and there was a lot of talk about, just maybe having students stand up in the middle of the day, do some movements, do some exercises, and you have specific programs like healthy cooking, nutrition detectives, ABCs. I mean, can you tell us a little bit about some of those programs?
Sure. So when we started, we knew we couldn't tackle every school at once. So we started with elementary schools because we already had 2 programs developed. One is that ABC for Fitness program, and that's where students do get up and move in the classroom.
Just such a great idea. Simple thing, but great idea.
And it helps just kind of refocus their attention and get them ready to learn. And so the idea is quick activity breaks, 3 to 5 minutes long, a couple times a day, to try to add 30 additional minutes of exercise per day. So we have manuals for the teachers. We help give them great resources of different activities that they can use. Nutrition Detectives is another program that we have. That's our nutrition program from elementary school students. It helps them learn how to see what to look for on the front of a package and what is not always true. And so when it says it's healthy, you really have to look at the nutrition label, and you have to look at that ingredient list. Kind of gives them those clues as to what to look for to make sure a product is healthy. And so we started there, and then we've been branching out a little bit. We now have a program that's kind of similar to the Nutrition Detectives program for middle school students now, called Your Road to Health. So we're trying to slowly get our way into high schools as well. And so other things that we're doing with older students are like gardens, and that's kind of brings in our partnership with Massaro. And wellness clubs for high school students is another thing that we've started recently.
Oh, that's great. And now, Ruth, we want to bring you in. Tell us a little bit about the Massaro Community Farm.
Sure. Yeah, so Massaro has been around for about 5 years now. It was sort of a defunct dairy farm that the property was left to the community of Woodbridge, and they decided that they wanted to keep the land in farming, and to create this community farm where people could learn about healthy food, and there's a functioning CSA there. So my role is a little bit different. So I'm a Food Corps service member, and Food Corps is a national part of the AmeriCorps network, and we place emerging leaders in communities all over the country to work on these exact issues. So nutrition, school gardens, and working with school food more generally. So I sort of do a mix of this nutrition-based work. I do a little bit with nutrition detectives in the elementary schools in Ansonia, and then, but the bulk of my work really is the school gardens. So I am sort of a resource for school gardens within the community. I work specifically in Ansonia, mostly at the 2 elementary schools and at Ansonia Middle School. So it can be everything from working to get grants or physical resources for the gardens, and VITAHLS has been super generous and a great resource for the Valley in general and school gardens. To also, like last year, I ran a training workshop series for teachers. So how can you connect the school garden to the curriculum, and how can they match activities in the gardens to the standards that they're already working on? So this sort of thing, trying to think a little bit more broadly. Often people think of school gardens as just science, but you can hook it into math and art and reading and writing and social studies. So helping sort of provide resources and training for that is a big part of what I do too.
And teaching students how to grow their own food is kind of like a vital life lesson that VITAHLS, playing on that. But it really is, and it's interesting that, maybe for many years that wasn't happening. I mean, how many schools now have started these gardens?
Gosh,
Any
I think
idea?
We're in at least 3 of our districts do have several,
Right.
and they're growing each year. And we've seen some really great things come out of them. Each school's doing their own thing with them. Some of them have started garden clubs after school.
Yeah.
Some of them are trying to bring it into several different classes. Like Ruth just said, you could do science, you could do math, and also it gets them out of their chair, and it's
Right,
also
it's
physical activity. And they're also, some of them have kitchens where they can bring the food in and prepare food from what they've grown and try it, probably exposing them to vegetables or fruits that they haven't tried before. So we've seen some really great things come out of the school gardens, and Ruth has been a really great help being a good resource.
And yeah, we really find that kids are so much more likely to try fruits and vegetables and to like them if they've grown them themselves. It's like they're a little
That's
more
interesting.
invested.
Yeah.
Yeah, so
makes sense.
it sort of takes a different form at every school. Some schools, like Gina said, have after-school clubs, and that's sort of the core of the garden work. And some, it's very integrated into the science curriculum. It sort of depends, and it looks a little bit different at every school and every community, depending on their needs.
Now, you probably both can answer this, but how have parents reacted? Have they been learning a lot from this program? Gina, what do you think?
We're actually just starting to reach out to parents more. We've really been focused on the schools lately, but over the past year, we've started sending out monthly newsletters with healthy recipes and tips to get your kids up and moving as a family. What can you do on the weekends? But now our sort of future plans include more of the parent and community outreach. So we really want to work more with parents, and then to the community, the 4 communities that our schools are in. So future plans sort of include cooking classes for parents and children. So that's sort of one thing that we wanted to try to tackle first. We think that might be a really great way to teach nutrition, but also have a hands-on, kind of like the gardens are a hands-on component. We've been doing a cooking contest with students for the past 2 years, and we've noticed that kids really enjoy cooking and they get really excited about it. And so we hope that having sort of classes where they can come with their parents and learn how to cook and learn about nutritious meals, that would be a good next step. So that is something that we are planning on doing a little bit more of.
Well, a program like this obviously needs a lot of community support, and it's not free. So I mean, how can people get involved or help, and just be part of it?
So probably the quickest, we are on Facebook. We are on the griffinhealth.org website, but also our number, if anybody had any interest in speaking with me directly and learning more about what we do, we're 203-732-1265, and I'm at extension 305. And, I think that kind of if you have a child in one of these school districts, kind of be on the lookout for our newsletters. A lot of the districts have our newsletter up on their school website. That's one way that they distribute it out to the parents. And just contact us, and we will be reaching out to parents more. There will start to be more opportunities for parents to get more involved with what we're doing.
That's great. And just curious, do we see the tide shifting? I mean, childhood obesity, we've been talking about it for years now, and it's a growing epidemic. Do you guys see things changing, at least on this community level?
I think it's going to take some time, but
Right.
I do think that we have grown. Our list of partners is growing. We have some really great community partners involved. We have the Valley YMCA, the Naugatuck Valley Health District, ShopRite, recently hired a registered dietitian for the area that's going to come on board and help us out with some programming. So we really have some great partners. I think we've grown a lot, and I think that hopefully as we build our program lists and are able to get out into the schools more and in the community more, we'll start to see some things shift. It's going to take definitely more than 1 or 2 programs. It's going to be several layers of programs that help to at least raise awareness.
There are a lot of big system-wide causes of this problem, so it's definitely a long-term project. But I will say that at the first staff meeting at Prendergast Elementary School this year, Principal Apicella said he has seen a change in the kids' attitudes. So that's unscientific, but an important testimonial.
Yeah, it is. And Ruth, how can people find out about the Massaro Community Farm?
So massarofarm.org is the website, and I would recommend you check it out. There are a lot of different programs that are free and open to the public. public. Just in a couple weeks, on October 3rd, we have our annual Family Fun Day from 1 to 5 p.m. at the farm. So totally free, open to everyone. There will be lots of activities for kids. We also have a nature trail that is free and open to the public every day between sunrise and sunset. So I really encourage people to come stop by. A couple times a month we do an open farm day when we invite families to come to our learning garden, which is smaller and really just designed as an educational garden. It's separate from the rest of the farm, and we invite people in, and we're always working on different things there and have different activities going on. So yeah, that's a big part of what I'm doing, also sort of helping build the community around the farm beyond the town of Woodbridge, because that's how it started. The farm is in Woodbridge, but we're really trying to build a lot more connections with the greater Valley community.
That's great. All right, well, ladies, thanks so much for joining me. I mean, you guys are doing great work, so we appreciate you coming in and telling us about it.
Thank you.
Thank you so much for having us.
All right. Well, that's going to do it for this Coffee Break Extra. Encourage everyone to find out more about the VITAHLS program through Griffin Hospital. That's going to do it. I'm Kate Czaplinski. I'll be back tomorrow at 11 with your Coffee Break.